This slide here summarizes all the information about the fluoroquinolones. As you can see in this slide here, we have fluoroquinolones with the first generation represented by naldexic acid, the second ciprofloxacin, then we have levofloxacin belong to the third generation, moxifloxacin, levofloxacin belong to the fourth generation. Again, this slide summarizes all the information about fluoroquinolones. As you can see, naldexic acid, first generation fluoroquinolones, considered like narrow spectrum antibiotic used for the urinary tract infections, followed by ciprofloxacin. The spectrum, antibacterial spectrum increased, more effective than naldexic acid. Ciprofloxacin used for traveler diarrhea, urinary tract infection, typhoid fever, anthrax. Moving to the levofloxacin and moxifloxacin. This is, as we mentioned, this is a synopsis of fluoroquinolones. Levofloxacin, moxifloxacin, considered like respiratory infection antibiotic. So used for treatment of respiratory infection. Used for treatment of anaerobic, for example, when we have bacteroid fragilis, we use levofloxacin, moxifloxacin. Levofloxacin, moxifloxacin used for pneumonia as specifically community-acquired pneumonia, CAP. Then we have levofloxacin. This may be the most important characteristic for levofloxacin is used to treat MRSA, methicillin resistant staphylococcus aureus. What we need to know about fluoroquinolones, as you can see, we have fluoroquinolones, the suffix floxacin, FL stands for fluoride, floxacin, xacin stands for the antibiotic. Fluoroquinolones will distribute through the kidney, lung, bone, stool, and white blood cells. That means fluoroquinolones able to enter the cells, able to enter the macrophage and other white blood cells. Okay, we can prescribe the fluoroquinolones orally, and we have some of them prescribed IV. We're going to discuss that later on. How this medication work for fluoroquinolones, mechanism of action, we need to remember that the fluoroquinolones inhibit topoisomerase 2 and topoisomerase 4. We have some warning, precaution, and we need to remember that. Don't use this medication in children less than 18 years of old, or during pregnancy or breastfeeding. We have some maybe black box warning. We are going to speak about that. The question now is the fluoroquinolone, or are the fluoroquinolones bactericidal or bacteriostatic? Fluoroquinolones considered bactericidal. That means fluoroquinolones able to kill the bacteria. Moving to the next and the important topic here about black box warning, that fluoroquinolones may cause tendonitis, tendon ruptures, peripheral neuropathy, and central nervous system effect.